Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Long moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that House File Number 3342 be given its second and third readings and be placed upon its final passage.
Representative Long.
Thank you, Madam Speaker. That is my motion to allow us to take up our bipartisan agreement to help support our nursing homes.
Discussion on the motion to declare an urgency. The member from Stearns, Representative Demuth.
Thank you, Madam Speaker. And members, I would encourage a green vote.
All those in favor of the motion, please say aye. Aye. Those opposed, please say no. The motion prevails.
Yes.
The clerk will give the bill its second reading.
Second reading, House File Number 3342.
Second reading.
You can say the clerk will report the bill.
The clerk will report the bill.
I don't have the bill.
It's the last
one. House File Number 3342, an act relating to human services.
I recognize the member from Hennepin, Representative Noor, to describe the bill.
Thank you, Madam Speaker and members. I know most of you have been waiting for this bill. This is one of the most important bills that we have before us today. Members, you've heard about the financial distress that nursing facilities are facing. We've heard from many of our colleagues come to us and say we have to do something about it. With the leadership of Madam Speaker, who really brought us together to make sure that we do something this session for the nursing facilities. We also know that the challenges that the hospitals are facing because they cannot discharge patients to a safe settings. Members, the bill before you is in addition to the work that we did in the Human Services Bill or budget. In that bill, as a reminder, we had $90 million for workforce incentives that will go to also to the nursing facilities. We had $100 million loan program that will go to the nursing facilities on a 0% interest, 18 months delayed of payment with the terms decided by the department and also the nursing facilities. With this bill, Madam Speaker and members, we're providing additional workforce incentive program only for the nursing facilities of $75 million. That means the nursing facilities will be able to provide bonuses. They'll be able to provide incentives for their workers of up to $3,000 per employee per year. Those employees who are making less than $30 per hour will be able to receive that funding. They can use it for housing, for childcare, for other needs that are necessary to support the workers. This will help with the recruitment and retention of employees in the nursing facilities. Madam Speaker and members, within this bill, we're providing $173 million payments of $225,000 to each facility in the state of Minnesota. And then the remainder will be divided based on the number of active beds for that nursing facilities. This funding will go out effective August 1, 2023 for the first payment, and then the second payment will be August 1, 2024. Members of Madam Speaker, the payment will be more specific rather than items that will increase the VBR. And if there is any increase based on the projected focus, that means there will be clawback for all the nursing facilities. Madam Speaker and members, we also have a small rate temporary increase of $12.35, which is $51 million. This will add the rates for 18 months effective July 1, 2023, up to December 31, 2024. Members, this $51 million with the addition of private pay and also the federal matching dollars, which is within the, under the UPL, which is the upper payment limit, we're able to leverage $134 million for the nursing facilities. Members, this is a great opportunity for us to address the needs of our seniors, and this is a great bill, and I ask for you all to support this bill and vote green.
Discussion to the bill. The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members, and I would rise in support of this bill. It's interesting to get this put together. I heard a lot of complaints about the way that the VBR system was set up for nursing home funding over the last few days. I think it's just really conservative of the legislature at that time to put legislation together that makes it so hard to add new money into a program like that that's supposed to be running on its own. Members, the value-based reimbursement program for nursing homes works as long as there's not a worldwide pandemic or epidemic or anything like that to try and deal with. When nursing homes were faced with keeping their doors closed, with only allowing certain people in all the time, when having the National Guard in their parking lot in order to check the COVID status of nurses before they came in and out of the facility, it caused a lot of excess work, a lot of burnout in the process. You couple that with the great resignation that we have and just the overall overbearing work that our care providers offer, this starts to become inevitable. This process caused by a pandemic meant that a lot of facilities had trouble bringing in new residents to help cover their bottom line as they provide care, and so then they have to restrict hours or hire pool nurses to cover, and pool nurses come in at 2 or 3 times the charge of what an in-home, what a local nurse would have for that. And so nursing homes had to do what they had to do, which was drain their reserves and take out lines of credit in order to pay people to keep the doors open as well as they could. And that creates problems with what we are seeing today, and that's what they're trying to alleviate with this program. So what we'll see here with this is that in the first 2 years especially, money will be put in with a baseline rate increase as well as some other other funding mechanisms to help with that so that they can really get back up and start hiring nurses that they can afford to have in-house instead of taking the pool nurses, being able to pay off some of those lines so they have a little bit more breathing room in their operating costs and the cash flow issues that they've faced, and really is a good way. We were able to get something bipartisan put together. I will say it was a whole lot easier to work with House and Senate Democrats than it was with the department, and so I have a new appreciation for the people in this chamber after the last few days putting this together. And so with that, members, I would ask for your support. Thank you.
There is an amendment at the desk. The clerk will report the amendment.
Noor moves to amend House File Number 3342. The amendment is coded A1.
Representative Noor.
Thank you, Madam Speaker and members. I think I described a little bit about the hospital decompression issues, where patients are still in the hospital when they should be discharged. So this amendment provides $18 million for the fiscal year 2024 so that the hospitals can be reimbursed for up to $1,400 for partial reimbursement for qualifying avoidable patient days. So this is to help the hospitals address the discharge issues that they're facing. I ask you to support the amendment.
Any discussion to the amendment? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 3342, as amended.
Third reading as amended. Discussion to the bill. The member from Polk, Representative Keel.
Thank you, Madam Speaker. Wow. It took us 4 months to get this done. When I entered the legislative session in January, I knew that I had at least one nursing home hanging on the edge. So when I tried to work with powers that be, had conversations with Representative Knorr, Chair Knorr, Chair Fisher. We had conversations about it with the department more than once. You know, I didn't want to make public that my nursing homes may fail, but for fear that they would lose even more employees. There was high competition in Polk County as far as the workers, because they were offered other jobs. DigiKey, you heard about, offered them benefits as well, really good benefits, as well as a better pay per hour. And so that's why this was so imperative that we help our nursing homes. They were hanging by an edge. One of them is really going to hope to open up again. I don't know as that will happen. But my fear in rural Minnesota, especially up in our district, I don't know the detailed numbers, but we're a highly large baby boomer area. And so while we have PCAs and we have home care, many of my seniors don't necessarily have homes that will provide for the care they would need in a nursing home type setting. So I thank you, Representative Knorr, and everyone who worked together to get this done. This was super, super important. I don't have highly profitable nursing homes anywhere in the area. They are all very, very challenged. More than one of them had, I'm hoping this will help the one that had National Guard, like Representative Schumacher said. They were literally in the building trying to help out the nurses because the nurses were sick and they just didn't have anyone to take care of the residents that had COVID. As we talked about, it was high pay, 3 times the amount that a CNA or an RN was hired to do because of the nurses that we brought into the district. This has been going on long before COVID. We were having that challenge already. So I am so thankful that we are doing this. I would hope that in the future we think about nursing homes. You know, I would encourage all of you members, go visit your nursing homes. I have visited down here. There are some fantastic nursing homes that have quite a bit of opportunity. I'm not sure I can afford to stay in them because they are a different setting. However, they're so important. And March 17th, I probably have said this, but March 17th, my life changed. Now, I was thankful because I didn't need hospitalization for days. I could stay 24 hours and go home. But the reality is, I likely could have had those problems. And, you know, going to the nursing home in my district means rehab as well as just the care, so that as I rehab or as someone rehabs to be able to be independent and go home, this is part of the necessity of keeping these nursing homes open. Having the hospital funding, Representative Knorr, helps us to make sure that a family can not have to move their family member more than once. It is extremely traumatic when you're leaving the hospital to have to go to the nursing home, and I would hate to tell somebody, oh, by the way, you're going to have to go to this room, and then we'll have to move you here because of the staffing that needs to happen. So it helps them to plan, know what's going on, but this is a super important. I'm just thrilled that we're doing this. This is so important. It helps our rural Minnesota. I believe it does in the cities. The nursing homes are really in need of help. I'm glad we're going to educate, encourage, so that we have more nurses on staff so that there'll be that opportunity. I hope we encourage some high school students to think about it. You know, I'm old enough, I had a career in tech classes. I didn't take the nursing classes, but in my district, we have one retired doctor already. We have many nurses that work in different services, but all of them started their junior year of high school. And they learned all kinds of things, and then they went to college for a 10-month course out of the University of Minnesota Crookston, and then were able to work in the system. So it is just very important, and I would thank the members, really encourage you to vote green, and thank Speaker Hortman for getting us to get this done. Thank you.
The member from Chisago, Representative New Brindley.
Thank you, Madam Speaker and members. And the first thing I want to do is thank Chair Knorr. We had some very honest conversations, I think, early on about certainly our commitment to fund nursing homes, and you were honest with us about trying to find the money. Thank you for finding the money. So I think it is worth talking just for a minute about how we got here, because it is a cautionary tale to ensure that we don't get here again. It has been shocking to see the unwillingness of the governor's administration of DHS to put any funding into nursing homes. Shocking. Frankly, at the 11th hour, they're still trying to tell us why we just couldn't do it. And I think I know why, but I'm not entirely positive. But thank you to Rep. Schumacher. We put into place several years ago something called value-based reimbursement. And what that means is that nursing homes are actually reimbursed for their actual expenses. They're reimbursed for what it costs to run their nursing homes. The problem we run into is that there is an almost 2-year delay on those reimbursement rates catching up. So when you run into a situation like we've had over the last couple of years, where nursing homes incurred massive costs during the COVID pandemic, where we have had massive, in fact, historic, we've had the largest inflation in our country's history, nursing homes are being reimbursed based on rates from 2 years ago while paying the costs of today. You can imagine that this creates enormous holes in budgets that cannot be filled. On top of that, I believe Minnesota is the only state, I'm sure my staff will correct me if I'm wrong, that does this equalization with nursing homes. We do not allow nursing homes to charge more for private payers than Medicare payers. They are not allowed to charge any more money to people who are private payers. Now, this does not apply to all of our other systems. Assisted livings are not bound by that. So there may be different reimbursement rates in assisted living. Group homes, this doesn't apply to group homes. There may be different reimbursement rates or charges in group homes. And so these other areas of our healthcare system are able to make up some of those costs. In fact, we talked about this a little earlier when it comes to Minnesota Care. Actual costs here, Minnesota Care pays here, Medicaid pays here. Here are the actual costs, private insurers pay here. In our health systems, that applies. Like I said, in assisted livings, this might be the real cost. Medicare may pay here, or state programs may pay here, but private payers might pay here to make up those costs, to keep them solvent. Nursing homes do not have that same ability. In the state of Minnesota, we say that nursing homes must be equalized. They can't charge more to a private payer. So they don't have a mechanism to make up for the holes that are created when they're being reimbursed based on the costs from 2 years ago. They don't have a mechanism to make that up, which is why, I mean, it was shocking. Just last night as we're having this conversation, someone from DHS said, well, as we're talking about how we could possibly use this $300 million, he said, well, aren't the nursing homes finding the cash to pay for these things somewhere else right now? Well, some of them are, but mostly nursing homes are taking out loans, and they are now over-leveraged. We had this conversation the other day, so they can't take out more loans, or they're closing their doors. They're not just finding the money someplace else. The money really does not exist. The money really does not exist. And nursing homes have been closing their doors. So thank you, Chair Knorr, for your work in making sure that this was the final result. Because there were lots of things presented that still would not have worked for our nursing homes. But the bill before us tonight, this bill is going to go a long way to taking care of our senior citizens, and not just any senior citizens, the most vulnerable. This bill is going to go a long way towards taking care of those senior citizens who can't be cared for by the people who would so desperately like to do so. Their families just are not able to meet their needs. They need long-term care facilities, and this bill is going to do that. This is some of the best money we've spent all session, and I am assuming, I'm hoping, that we're going to see 134 green votes on this funding tonight to take care of our senior citizens. Thank you.
I recognize the member from Morrison, Representative Schultz.
Thank you, Mr. Speaker and members for this bill. I'm excited. I maybe counted up the number of times that I've been able to vote green on a bill that allocates an amount of money this year, and I think that this would be bill number 5 for me this year. And I'm excited about it because it has the right place priorities. We are finally bringing some fairness to the folks in my district and in communities across the state, especially as it relates to our aging community. One of the early tours that I did this session after being elected, once I was sworn in, I should say, was to one of the nursing facilities and aging communities in my district. And what I can tell you is I'm incredibly proud and grateful for the people who go to work every day in those facilities, caring for our most aging members of our community, our loved ones. And many of you know I come from an exceedingly small town. And in the last 2 years, we built and opened a brand new nursing facility in my town, my hometown, of 487 people. And I'm excited that a bill like this will provide for additional support for the numerous aging communities in my district. So I'm excited to vote yes. Thank you so much to the members who helped make this happen, and especially our Republican leaders who stood strong to ensure that we were providing this funding to support our seniors.
Further discussion on the passage of House File 3342. I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Mr. Speaker, and I just want to thank Representative Knorr. He knows how passionate I am. I know Representative Hussein does too. We've had conversations, and to my colleagues on this side and to our minority leader and Speaker Hortman, who worked with the majority in the Senate and the leadership there, to really hear the voices after a bill was passed Friday night that was really a great bill. but I wasn't able to vote yes for it because of what was missing, because of what was in it, but because of what wasn't in it. So on behalf of the seniors that are in 300 nursing homes, while I haven't ran a 24-hour facility for almost 3 years, and I haven't been a nursing home administrator since running an operation in that setting since 2001, I did it for 10 years. I think it's really important that you all know you made a difference. This will make a difference. And the nursing home administrators and the staff and your family members are going to see a lifeline that's really, really critical for Minnesota nursing homes. And I'm committed to help work on policy and reimburse working with DHS to try to fix this, because we have the biggest group coming through, the baby boomers, and we have to get it right. So it's a Band-Aid, but it was a really critical one. And so I just want to tell you thank you for your leadership and a bipartisan effort for the frailest of the frail that are in Minnesota nursing homes, and for the staff that have stood by them all through some really tough years. So thank you for doing what's right for Minnesota. I'll be voting yes.
Further discussion. I recognize the member from Douglas, Representative Franzen.
Thank you, Mr. Speaker and members. I just want to thank the nursing home facilities for sticking with us during this session. There was a lot of emotion going on, a lot of emails, a lot of phone conversations, and they did not give up in the legislature, making sure that we did the right thing. So members, when you press that green button today, I want you to be proud and know that your nursing homes are supporting today's measure, although in my opinion, it should have probably been done months ago. But personally, myself, my nursing homes have been reaching out to me when the news hit that this bill was coming forward. So just thanks to the nursing homes for believing in the legislature that we would do the right thing. Thank you.
Further discussion. I recognize the author of the bill, the member from Hennepin, Representative Noor. I recognize the member from Brown, Representative Torkelson.
Thank you, Mr. Speaker. Everything has an order to it. The previous person in the chair had noticed me, so apparently she didn't write me down. Members, I'm thrilled that this bill has come to us finally, and I thank Chair Noor for his work for the most elderly, most vulnerable citizens in our state. I don't understand how the administration can have such opposition to this very important funding. It boggles my mind. So I stand here, I'm happy and disappointed at the same time. Honestly, this should have been one of the first bills that this body passed. This is a crisis. It's been a crisis since before we got here, and we've failed to address it until the last possible moment. That's a shame. It's a shame that this has become a political football, that we've made our elderly, the elderly that are near the end of their lives in their nursing homes, being cared for by some of the most wonderful people in this state, and we have made them the last priority. And we've allowed ourselves to make them a political football of this process. It's a dirty shame. This should be a #1 priority, and I hope that going forward as we go into the next session, into the next biennium, that we examine our priorities and understand that it's just not right. It's just not right to put these people at the bottom of the list. Please vote green on this bill.
Further discussion. I recognize the member from Ramsey, Representative Hussein.
Thank you, Chair Noor, for bringing and working and dedicating for this. I do have a lot of facility in my district as well, and this is a great investment for all of us in the nursing. And this will be our next step when we all grow up, and we need to take care of those ones that's in a nursing home right now. And this is the best we could do, and Chair Noor has worked hard day and night to take care of those nursing. And I do have a few family member who's in nursing home right now, and those nurses take care of them really hard. And this is the best investment that we could do. And thank you for doing this, Chair Noor, and please vote green and protect for those nurses.
Further discussion to the passage of House File 3342. I recognize the member from Stearns, the Minority Leader, Representative Damath.
Thank you, Mr. Speaker. And members, I believe that we would have actually addressed the nursing home funding crisis right away when session started. We knew that nursing homes were facing such a need, and that could have been done right away. When we realized that it wasn't being taken care of on our side of the aisle, we set up a working group to look a little bit deeper into the issue and look for solutions. Then on January 20th, the 4 leaders met at the governor's residence, and this was a topic of conversation that came up. And we said, could we possibly look at this before the end of session? And it seemed like there could be some type of an agreement. And so we went ahead and expected something to happen, even to have gone as far as declaring an urgency. That didn't happen. And so we invited members of our working group, the agency, members from the governor's office to come in and address the issue, and still nothing happened. I am very, very grateful for the $300 million that is coming late in session, later than we would have anticipated, but very grateful that it is happening for our nursing homes, the ones that are caring for the most vulnerable in our state. I'm appreciative to the work that was done on language that wouldn't have hampered the nursing homes to use this, to members from each one of our caucuses that gathered together and worked and beat out language that would actually work. As we have seen in the bills before us, the little bit of nursing home funding would actually be a loan and put them in a more difficult position. This is good language, better late than never. Vote green.
The member from Hennepin, the author of the bill, Representative Noor.
Madam Speaker, thank you so much for entrusting me to really address this issue. Human services is one of the most complicated areas. And when you add the value-based reimbursement, it even gets more complicated. You will need to have a deep dive into how the cost rating is set up. And it's great to understand there are individuals who were there when the VBR program, like Schumacher, who was leading that effort, to be in the room. I just wanted to thank also Chair Fisher, New Brindley, I represent New Brindley, in structuring this program. Members, as we talked before, there's $853 million already baked in the VBR focused program. On top of that, we added $100 million that will be available until 2029, which is a 0% interest, 18 months no payment, added on top of that. We also have $90 million in the previous bill that provides workforce incentive for the nursing facilities that is included in there. And in this bill, as I described before, we have $173 or $174 million that will be distributed to the nursing facilities across the state. That will be available for the next 2 years as we look into and study the VBR program. Then also we have the daily rates increase of $51 million in this bill, and that turns out to be $134 million combined with the federal reimbursement and the private pay. And finally, an additional $75 million that will go to the nursing facilities workforce investment. This is a huge investment. This is a significant investment. Unlike any other group that we have funded, this is an investment that is much needed today. We are supporting the grandma and grandpas who need that help. We're supporting our nursing facilities collectively today. This would not have been done if we had not continued to have the conversation. By bringing people together from both sides and also the department and working with the advocates, we were able to land this ship. We were able to do this work together. Members, for the last time on this floor, as I speak to you for this session, LFG, let's vote green.
The clerk will take the roll on the bill. The clerk will close the roll. There being 132 ayes and 0 nays, the bill is passed as amended and its title agreed to.